I'm Dr. Uma Dhanabalan. I did my bachelor's at Rutgers in Newark, New Jersey. I did my family practice residency at the Medical University of South Carolina, and I've done my master's in public health at the Harvard School of Public Health, and my residency in occupational and environmental medicine, along with a fellowship in heavy metals. I also have my diploma in cannabinoid medicine through the American Academy of Cannabinoid Medicine, and I'm a medical review officer. Cannabis has been a part of medicine for thousands of years, and it has been part of Ayurvedic medicine in India for many, many years, and it's been a medicine that has been used in our country and throughout the world. It is due to political reasons that this plant has been put into prohibition, and the misinformation and the propaganda that has been begun and continues in our world today. Up until 1970, cannabis was a medicine and has been put into Schedule 1 in the United States of America. What this means is that there's no medical use, no medical research, and a potential for abuse. What we do know is that cannabis was used in the United States, and it was prescribed by doctors, and it was in the United States Pharmacopoeia from 1850 to 1942. It was not until Harry Anslinger in 1937 when the propaganda changed from called cannabis to marijuana. Propaganda that was created was not because of science, but because of political reasons. At that time, cannabis was used for multiple reasons. Due to the Hearst, the DuPonts, Rockefeller, Carnegie, and Mellon, who had their own political agendas to produce their own synthetic molecule. Cannabis has been our medicine in India through Ayurvedic medicine. It is also considered as a sacred plant. We have the opportunity today to talk about different alternatives that are much safer and are not as deadly as the other medicines that are available to us today. Today, in my clinic, my youngest patient is 2, my eldest is 98. I deal with multiple chronic conditions and also terminal conditions like cancer. My younger patients suffer with epilepsy and autism and many cancers that are found in the young children. My adult population deals with chronic illnesses and also cancers and also for end-of-life care. Many of these patients suffer throughout the end. Cannabis can be incorporated and can be used as an adjunct with any treatment that they receive, and is much safer and much more viable because this does work with a system known as the endocannabinoid system. Cannabis has been a medicine that has been prescribed by doctors and has been used, and the research is there and has been available in our research, not just in the United States, but throughout the world. Cannabis has been used in comparison to other medications, is much safer, and can be used as an adjunct with any other pharmaceutical medicines as well. What we do know is that cannabis works with the endocannabinoid system that works with all other systems. That is why cannabis has a tendency to be considered as a drug that can be used for a panacea of conditions. What we understand is that the research has not been able to be done due to the legalities and the prohibition of this plant, not just in the United States, but locally and globally. The challenges the average healthcare provider and patients face today is that doctors do not know about the system. They are not legally allowed to talk about it because it is still federally illegal. Therefore, doctors also are not able to openly discuss this with their patients. Patients too know about this and they are curious, but because of the barriers today, patients are not getting the adequate care that we can provide them. I want to explain to people what is the endocannabinoid system and what we know about it. Endo means within, cannabinoid means it has something to do with cannabis, and it's a system. The function of the endocannabinoid system is to bring about homeostasis, ease, When we are not at ease, we are at dis-ease. And we have fancy terms, an itis, gastritis, carditis. Everything is an itis, which means inflammation. What we understand about the endocannabinoid system is if there is a deficiency in the system, which causes illnesses, when the system is overactive, it also causes illnesses. What we now know is that our body produces endocannabinoids. The first endocannabinoid that was identified is called anandamide. The first drop of breast milk a baby receives has this molecule known as anandamide. Anandamide means bliss, eternal joy. Dr. Raphael Mechoulam, who was known as the grandfather of cannabis, was the first to synthesize and isolate THC in 1964. It was not until 1988 that we understood that our body produced endocannabinoids, anandamide being the first. And what we understand is the molecule in cannabis, known as THC, mimics anandamide, and this is why it works with the receptors. The first receptor, CB1, is in the brain, CB2, which is in the immune system. These receptors are throughout the whole body, and that is why one plant works for so many multiple conditions. Everyone must learn that we have an endocannabinoid system, and India has an opportunity to go back to our roots and understand that cannabis is a sacred plant that came from our Ayurvedic medicine, and we have the opportunity to produce the very best and become the leaders throughout the world.